And also, new hope for the millions of Americans who suffer from chronic headaches. Could a new cutting-edge treatment be the miracle cure they've been waiting for? GMA is on call. When we come back, GMA on call. Could a bold but controversial headache treatment ease the pain for millions? We're going to tell you why some are calling it a miracle cure.
And now the doctor is on call for Good Morning America. We all get headaches from time to time, but 40 million Americans suffer from chronic headaches, some of them getting severe headaches more than 15 days out of every month. But there's a new treatment that could provide some much-needed relief. Could it be the cure everyone's been waiting for? ABC News medical editor Dr. Tim Johnson is here with the story. Tim.
Well, Diane, obviously there are many different types of headaches: tension headaches, migraines, rebound headaches that are caused by taking too much medication for headaches. This new procedure we're going to talk about combats a specific type of so-called chronic daily headache, which is caused by nerve compression.
It wasn't me for so many years growing up with the boys. It was a lot to miss.
For years, Lori Chinall's world was one of darkness and pain, all because of a headache that just wouldn't go away.
8 out of 10 days, it would be a pressure and a pain at the back.
Desperate to regain control of her life, she tried everything from pain medications to acupuncture, but nothing worked.
It got to be where really I had learned to live with it, and I would just go crawl in a hole, just kind of retreat.
Lori isn't alone.
Sometimes it's like a pounding when it gets really bad, but it's mostly like a pressure. Like my head is just gonna expand and, explode or something.
16-year-old Jevin Luxinger also has an ongoing headache, so painful he was homebound for his entire junior year of high school. Both Lori and Jevin suffer from chronic headaches, that is, headaches that occur at least 15 days out of the month. The standard treatment is medication, and if that doesn't work, patients must learn to live with the pain. Now, there may be a new alternative.
When a patient says to me, "You're my last resort, this is the last thing that's left for me to try," and it's really very compelling.
Dr. Pamela Blake uses a minimally invasive surgery for patients with chronic daily headache caused by an irritation of one or more of the nerves that radiate from the back of the skull.
So it's kind of like a pinched nerve you might have in your neck or in your back, and the pain radiates down your arm or down your leg. In this case, the nerve gets pinched, we think, in the musculature of the neck, and the pain radiates along the distribution of the nerve, which is up into the head or down into the neck.
Dr. Blake very carefully chooses patients who might respond, and then pairs up with a plastic surgeon, Dr. Carlton Perry, who performs the surgery. It's called nerve decompression.
Hello?
She has supervised over 100 operations and says so far results are good.
About 64% of patients had a greater than 50% reduction in their headaches after the surgery.
The operation is controversial. Other specialists say the surgery is in very early stages and still needs to go through clinical trials before they would recommend it. But Dr. Blake says for many patients, even a small reduction in pain can be the difference between being incapacitated and having a productive life.
To see all my friends get jobs and start to drive, and just to know that I might never be able to do that, but before I found this.
Today, Jevin Luxinger is having his surgery, hoping to get rid of his headache, which has been with him for almost a year. His mother, Carolyn, has been suffering along with him.
It's like I've been sitting back, watching my son slowly die, and not being able to do anything, and moms are supposed to fix things.
In the operating room, Dr. Perry can see that the nerve running through the muscle in the back of Jevin's neck is compressed.
These kind of findings of scarring in here are consistent with the people that get relief from this surgery.
Lori Chinall says her surgery 8 weeks ago was a success. While she still gets occasional headaches, they are less severe and less frequent than before.
I can't remember feeling like this. I mean, it was like so long ago, and I said, I feel like doing 10,000 things. I mean, I just can do it. I feel like I can do it all.
Goodness. Who would have thought? You can see a compressed nerve. You can
The
see
surgeon
it.
can see when they go in and make a pretty good prediction about whether they can bring
And
relief.
do we know how Jevin is?
Yes, he's 7 weeks after his operation. His mother says he's doing remarkably well. He's exercising again. He's going back to school. She sees a huge change. Sometimes it'll take 2 or 3 months to know what the final result will be.
We look at it, hear about it, and think it could be dangerous, is it?
Not really. This is a very simple surgical procedure. You don't cut any nerves. You don't go into any brain tissue. You're basically just removing some muscle and or connective tissue to relieve the pressure on the nerve. So from a surgical viewpoint, it's very, very simple. There's a slight risk, as always, from general anesthesia. But one of the reasons I'm cautiously excited about this procedure is precisely because it doesn't cause any real damage to tissue.
So looking so far, they've done about 100 people.
Yes, she's followed
think it's
over.
promising?
I do, because she's followed over 100 people for at least a year now and getting the kind of results she mentioned, over 2/3 with at least 50% improvement. Some patients over 90% improvement. It's not for everybody, doesn't work for everybody. But given that these patients are so desperate and have tried everything imaginable, I think this is worth considering in selected patients.
So if you think it's sitting at home that it could be you and you're suffering from this, how do you know if you're one of the candidates?
Well, you have to go to a good neurologist who's willing to consider this possibility, do the testing to make sure it's these kind of nerves. The problem is going to be finding surgeons who are doing this. Right now, there's only a few in the country, but I think after she publishes her data, a lot more are going to get interested in it.
And what about medications we heard mentioned? Any other general treatments that might address this?
Well, general treatments, of course, besides medications, people are trying acupuncture a lot. There is another specific treatment for this so-called occipital nerve compression, namely an electrical device that sends signals to this nerve area. It's tried, sometimes helpful, but not generally so. So there's a place for this new kind of treatment.
Well, again, as she said, if you give somebody back a few days every month, a week every month, it can make a big difference in their lives.
For sure.
Thank you, Tim Johnson.